One of the biggest challenges that families face when they have a loved one at a post-acute rehabilitation facility is the lack of support with the care coordination once their loved one arrives home after discharge from that facility. And let me explain. When you have patients that go through a hospital and then a skilled nursing stay, when that patient's at the skilled nursing facility, they have access to a multidisciplinary team of specialists, from nurses to doctors to therapists to social workers. They're all in working with that patient collaboratively on a daily basis. And that family has the ability to be at the facility as much as they want. And sometimes families are talking to their social workers, talking to their therapists on a daily basis, sometimes multiple times a day, about their loved one. They're getting their needs met efficiently. They're getting their questions answered. But once that patient comes up on discharge and arrives home, all of that support and the ability to have help carrying out that discharge plan really goes the way. The social workers and the team at the rehab, they pass the baton to the family. They've gone over the discharge plan with the family prior to their loved one leaving the skilled nursing. But once that patient comes home, it's on the family to carry out that very complicated discharge plan a lot of the times on their own. And one of the best ways that we can help combat that is to bring in the senior advisors prior to that patient coming home from rehab as basically the other end and the person that's going to take the baton from the rehab team to help quarterback the care once that patient comes home from rehab. And one of the toughest things that we face every single day is that these rehabs, they work so hard and they spend so many times, sometimes hours and hours on a weekly basis with these families, educating them, talking to them, coaching them, making sure that they understand everything. And even though they put all of that effort in, it still is very challenging because healthcare and caring for an aging loved one is just so complex. And the best way that we can help not only the patients and the families, but also the healthcare system as a whole is to partner with companies that work in that transitional care risk management space, that work after that discharge from the post-acute center with the families to make sure that the family understands that discharge plan that the rehab had set forth and works so hard to develop for that patient, and they help them carry it out efficiently. And so if you have a patient at a skilled nursing facility, think about how awesome it is when you could bring in a professional that's going to build rapport with the family while that patient's at the rehab. They're going to work hand in hand with your team, making sure that they understand all of the aspects of that patient's discharge plan. And then as the expert in the healthcare system, once that patient comes home from the rehab, that senior advisor is going to be in the house on a weekly basis. And that's what we do at Proactive. We are in the house on a weekly basis for the first, sometimes 1 to 2 months when that patient comes home from the rehab, making sure that that plan that the rehab put together is being carried out efficiently, making sure that the family understands what their loved ones needs from a care standpoint, making sure that they can afford it. And if they need extra services that maybe weren't coordinated by the rehab, then us as certified senior advisors, we have the connections and we can bring in the elder law attorneys to help families that maybe don't have a power of attorney or a living will set up. We can bring in our senior living partners for families that know that their loved one's not going to be able to afford home care for the long term and is going to need to be placed. And we can do that all while making sure that we're helping the family at their own pace, making sure that we're answering their questions, and that family can rest assured that they have a professional in their corner that knows the system and is going to make sure that their loved one is set up for success to continue rehabbing and ultimately not get readmitted to the hospital.